News 13 wishes anyone who is not participating in this year's purge a safe evening, and for those releasing the beast, a successful cleanse. Good luck.
Rika is a 20-year-old who has been diagnosed with substance use disorder due to her pharmacologic use of methylphenidate to treat her ADHD. The client expresses a strong desire to win from smoking recreational drugs to feel better with herself and her life. Yet, the client expresses that she circles back to her cravings and feels bad about herself for not being in control and being undisciplined. She expresses the want for a change to her psychiatrist. Hence, she was referred here for a counseling which specializes in Adlerian therapy. Adlerian therapy, which is also referred as Adlerian integrative therapy, is a holistic technique in counseling which is earned from its psychodynamic perspective of human psychology. It emphasizes the individual's overcoming of feelings of inferiority in order to achieve success. Furthermore, it also values social interaction to shape one's purpose. In counseling practice, human behavior is viewed as conscious and goal-directed. Thus, the Adlerian therapists apply methods that promote growth and resilience to overcome and redirect the client's inferiority feelings or faulty private logic. Redirecting the client's faulty private logic is typically applied with fictional finalism, wherein it enables the client to brainstorm a central goal to give the client a sense of purpose and autonomy to guide their behavior. The therapeutic process of Adlerian therapy can be inferred as positive, humanistic, integrative, and goal-oriented. Its integrative feature meant that it is not just a linear or a one-way approach in assessing the client's problem, unlike the blank slate approach of psychoanalytic therapy. But it is flexible enough to integrate other therapeutic approach like the person-centered therapy, cognitive behavioral therapy, or solution-focused brief therapy. Several therapeutic processes can be integrated with this approach depending on the client's needs and the therapist's goal in a particular session, as long as it will shed a positive light in the client's strength in a particular goal that they were trying to achieve. The application of Adlerian therapy are usually observed in family counseling, school counseling, drug addiction rehabilitation, and anxiety.
Hello! Sorry, dito kasi. No, it's okay. Hello, Rika. I'm Joyce, your therapist for today, so I am glad to have you here. So, how are you feeling today?
I've been stressed lately, but I know I have to change. But it seems that I can't.
Are you comfortable where you are right now?
Not really.
I understand you, so don't worry, I am here with you. Okay, first things first muna tayo, Rika, ha? Upon checking your medical records and based on your initial interview, from which you have been really open about it, you have been recently diagnosed with SUD with impaired control over substance use and a differential diagnosis of ADHD.
Yes.
Okay, that's clear. Do you have any concerns that could influence our session for today?
None so far.
Okay, so before we proceed, may mga bagay akong gustong klaruhin or i-clarify. Di ba you signed a non-disclosure form and another waiver form that contains your right as a client? And about the confidentiality concerns naman.
Yes.
Okay, so I'll simplify its contents for you. Our counseling sessions will always serve your best interests, and as your therapist, I'll make sure that this is something that can be deemed as beneficial for you. As for the confidentiality naman, as a psychotherapist, we conform to the ethical guidelines and principles that are bestowed upon us, and it is embedded in our practice and also stated there that as your therapist, I am not treating you in a way that I emphasize I think what's effective or best for you. Rather, I am treating you based on what you think is best for you, and in any way, I'm not imposing something to treat you, but rather we are just exercising options that you think that could work for you. Does it sound good?
It does sound good, but I highly doubt that I am capable of that.
As your therapist, I am here to guide you throughout this process naman.
Okay po.
Okay, let's jump in sa framework ng confidentiality. And I just want to assure you that kung ano ang mapag-usapan dito, hindi ito makakalabas nor may ibang makakalam. So as your therapist, it is my duty to make sure that everything about you, your name, age, and other demographics are strictly confidential and anonymous. So in this regard, if ever I need help from my superiors, your identity is kept as anonymous. Basta walang makakalam. And it's just you and me, and I assure you that we talk about in this session and other succeeding sessions is kept between you and me.
Clear po.
But I just want to inform you that it is also in my call to breach this confidentiality, and that is if I believe that you and other people are at risk of any serious harm. It's that the case I would have to disclose it to the proper authorities.
Clear po. During the first part of the counseling session, it is important for the counselor or the psychotherapist to engage with the client, and this is to be established by building a relationship with the client in order to forge mutual respect and trust to maintain a good psychological climate with one another. Furthermore, it enables the client to make inferences or initial impressions with the therapist. The phase of establishing rapport or relationship building usually starts with the initial disclosure of the client's nature of dysfunction, in which it is usually observed during the intake interview. In this regard, the initial disclosure has been shown in the forms of the intake interview and the filling in of the lifestyle assessment questionnaire.
So Rika, can you tell me about your dilemma?
Well, I have been diagnosed with ADHD and I have been under medications, specifically Ritalin. I did not know how I even started with cigarettes. But one night, when I was in the verge of my breakdowns, I started smoking one kasi naalala ko, sabi ng mga tita ko, soothing daw sa nerves. So I tried them. For me lang, it worked wonders because I was productive that night and ang calm. So, whenever I'm stressed with the demands of my work, ganyan, I'm working in real estate kasi. So, I would pull a cigarette and light it. It was never a hit or miss.
How many packets would you consume then?
I can consume about 3 to 6 packets a day. Depending pa yun sa araw and dun sa my workload.
Okay. Based on your medical records, Anorika, from cigarettes, how did it lead you to try smoking other substances other than drugs?
Well, it was a party with my subordinates since we just sold 100 million worth of property. So we rented a staycation house in Antipolo. We're partying and such, and napansin ko that they were smoking. I thought they were just vaping. Kasi lasing na kami nun. And then one of them said that they were having yung pot session, and I don't know. Then kasi I think it's one of my people pleasing tendencies. Nakasali ako. And then I somehow became dependent on it. It was soothing. Kasi wala, mind empty ka lang dun.
Thank you for being so open about that experience of yours. And I think it's your strong desire din to win from it and yet failing from it din, as you said during our intake interview. Okay. How does it make you feel when you try to stay away from it and every time, as you said, nag-circle back ka rin sa pagiging dependent on smoking substances?
I feel like a massive failure. Ang taas ng pinag-aralan ko and such. And yet, natatalo ako ng mga ganyan.
Can you tell me about being the massive failure that you think you are?
Well, I have spent a lot of money from both vices, medications, and also yung therapy. So, I felt that doon na lang din umiikot yung buhay ko. I haven't been able to find myself nor time for it. Because guess what? I have to make money for this and not for the luxuries like vacations and material goods. It's not that I can't afford what are tangible, pero walang appreciation, and it makes me like a superficial person.
I see. Let's slowly unpack that part on you feeling like a failure because you can't win from your vices, which have been working from you. Pero I'm not telling you that you should continue from it, ha?
Yes, I understand naman po.
Pero why can't we shift it into something positive? Positive because you are resilient in helping yourself, not by smoking substances, but your resilience in making a change and destroying your old patterns. As I have observed in your lifestyle assessment, you have an outstanding list of credentials and you have indicated on your strengths and as well as in your weaknesses. But let's not focus on these negative effects because we want to focus on your strengths to reiterate the situation, and we want to challenge the existing negative beliefs you have with yourself. And maybe do not be so hard to yourself for what you think and you did wrong or what you're doing wrong. And this is, I think, would be the goal of our session for today.
The therapist expressed her unconditional positive regard for her patient. Although, this specific technique is mostly done in person-centered therapy. Focusing on the client's positive attributes is also one key feature for Adlerian therapy because it is positive and humanistic in approach. Due to its positive and humanistic approach, it encourages goal setting, which subsequently outsources the client's strength toward a behavior change and overcoming perceived barriers. In this regard, the therapist's positive view of Rika foreshadows the integrative views of the early recollection and the acting as if technique in the succeeding scenes.
Rika, let's transition our talk a bit. So let's talk about your family growing up. How was it like?
It was heavy. I don't remember a thing or two about my mom and dad. Narinig ko lang is that my mother got pregnant by my father and then he left. Ayun, basically she was left alone with a child. And I think na kaya pala siguro ako iniwan lang because she hated me. She never even tried to reach out for me, and finally, nung yung mom ko nag-gave birth na siya sa akin, I just ended up with my mother's two eldest step-siblings who were spinster. Communications between them and my mom, zero. And somehow, I felt that sinisisi nila sa akin that they ended up as spinster kasi they're too busy providing for me. Though I never really experienced that parental warmth even though I have two maternal figures with me.
That was a lot to go through as a child, Rika.
Yeah, pero the more that I realized it's their choice naman to find a spouse, diba? It's not that they have fully provided for me when I turned 18. Yung house namin, it's not even theirs to begin with. Nag-hustle ako as a student kasi kung hindi, maglalakad ako ng nakapaa papasok ng university.
How does that make you feel growing up?
As a child who wants love, it hurts a lot. Seeing your classmates who are held by their parents after events, binibilhan ng ice cream, ganyan, after school events. Meron pang pag-gift tuwing graduation. Yun, nakakaingit and sobrang masakit. And when you realize na ang hostile ng environment mo,
Sorry ka. Ang nangyari sa'yo, bubulis ka din, parang nanay mo. Tapos iiwanan ka sa amin. Iwanan mo sa amin. Sa lahat ng bugok,
Kayo lang ng nanay mo yung napisa.
Top 4 ka lang, Rika? Hindi ka ba nainggit sa mga klase mong top 1? Boba ka talaga.
Anong ice cream, ice cream? Uuwi na tayo. Halika na! Tara na!
Rika, kalat-kalat na naman dito. Hindi ka na naman naglinis. Malilintikan ka talaga sa akin, ha?
Okay. But to be honest, Rika, I'm seeing a disconnect here. Based on your lifestyle assessment, you have had a thriving academic life, I would say. Based on that, can you lead me on how what you said, like their lack of parental warmth, and how led you to develop SUD and now seeking treatment?
All the physical and emotional trauma they induced have led me to it. They're too closed off. So, as a child, ang naging natural instinct ko noon is to be basically a good girl. I thought that getting good grades, joining the school band, being active in school organizations, and receiving multiple scholarships from elementary until nag-college ako, I would finally gain their love, pero wala talaga. I'm mostly ignored, pero ang hindi talaga nila ini-ignore is yung mga pagkakamali ko lahat, as in.
Mistakes like what?
Nung bata ba ako? Or right now?
Are you comfortable with both?
Yeah. Nung bata kasi ako, whenever I bring home, not so good grades, like galit na galit sila, and would hear words such as bobo, palamunin na nga, puro gastos dulo. Ironic because parang zero visibility ako sa bahay, pero pansin yung mga flaws ko. Though that's not even the whole, both of them are sort of neat freak.
Yeah, it's okay.
They're both neat freaks. Like, they want the house to spotless. Kasi nakakahiya raw sa mga amigas nila. Like, puro babae kasi kami doon and hindi matend ang bahay. As a child kasi, aminado akong malikot ako. Hence, have led me to be diagnosed with ADHD later on in my life, diba? I am not someone who can sit still. Though it helped me to secure, alam mo yun, multiple rackets. Though it left me burnt out. Pero ayun, sa kalikutan ko noon, madalas ako nagkakalat since naglalaro ako mag-isa. And lagi akong napapagalitan for that. Yung mga gamit kasi nakakalat kung saan-saan, nakakabasag and such. May physical punishment pa madalas. Yung, alam mo yung dulo ng belt, yung bakal, yun yung palaging tumatama sa akin. But one particular punishment have left me begging for them. I felt like I almost died that day. Remember, when you saw me na pinupunasan ko yung table kasi nakakita ko ng slight na dumi. It was an automatic response to get rid of it. It has been out of habit, but not exactly a compulsion nor ritualistic behavior. Noon kasi, natapon ko yung chocolate drink ko that time. Siyempre, bata, walang common sense. I pressed that chocolate pack that I was drinking and sumirit siya palabas nung straw. Yung iniinom ng chocolate drink. So, hindi lang siya nag-fountain sa damit ko nun, pati dun sa may sofa ng tita ko. And, nung nakita nila yung mancha. Nung nakita ko yung mancha, I know it's not going to end well. She pulled my hair, kinurot ako, pinalo, and sinako ako sa puno ng banaba until maggabi. Can you imagine?
That was a lot to go through and that actually left me speechless. To be honest, words, I cannot easily string my words together.
And as of now, another stress came through because they have barged into my office, telling everyone that hindi ko na raw sila sinusustentuhan. Like, basically, skandalo talaga. Nag-escalate pa yun sa social media and tagging my business account on Facebook. Siyempre, yung part executive sees those, yung threat sa line ng work ko. So, it is giving me an additional stress.
How did you manage those stressors prior to this session?
I smoke pot in my condo and reorganize my kitchen, reasons as it sounds. Pero ayan, ironically, I like structure yet I'm also a messy person. I like smoking substances, yet I smoke with guilt halfway.
Okay, you are heard by Mirika. So let's backtrack a bit, shall we? Basically, you being an achiever your entire life and is actually a result of your trying to win that affection and warmth from your aunts. So your wins are not actually recognized by them, yet they always point out your mistakes, which often leads to physical and emotional pain. And because of that, you develop a distorted view of yourself whenever you do mistakes, which are mostly mundane. From these pieces that we're trying to type all together, how do you think it leads you to smoking? And is it your mechanism or escape, or it's stemmed from a different reason?
I think it's more of the anxiety and pressure noon na na-induce of trying to keep my ADHD tendencies. By being overly organized and trying to keep the house clean. Iniiwasan ko na yung matitinding punishments. Basically, mas kabado pa ako sa mga palo at sa bunot ng mga auntie ko kaysa sa nung nag-entrance exam ako way back then. Pero yung parehas na physical manifestations like yung bilis ng pagtibok ng puso and lightheadedness na nararamdaman ko to keep the house and my room almost spotless. And yung kaba, minsan sa work and sa dating, dati sa school, doon siya nagsimula. To stay calm, I resorted into smoking many packets of cigarettes doon. Tapos, pot smoking, even tried candied marijuana, anything of sort. And now that I am trying to stop, I can't help of feeling like a failure. Talaga, for craving it and attend to it. It's something that I can't win over.
I disagree. Are you agreeing with me? Actually, part of the process of your winning over it, you have been triggered, and instead of choosing to listen to the instant gratification of what your body wants to choose to delay it, so it would be benefit you in the future. And I think that you always went hard to yourself when you don't get your desired result. However, you don't give enough credit to yourself when you were trying to exhaust all your options just to get the win that you wanted for yourself. Okay, so we would employ the acting as if technique. Basically, we would brainstorm ideas or behaviors that you think will help you from lessening your cravings with smoking and picking a behavior that you're most likely going to follow to lessen this appetite. So, are you comfortable with that? Okay, so what behaviors you think you can engage in that would limit that hunger for smoking either cigarettes or drugs?
We're trying self-help books, though they were some kind of a help, I think. But the guilt and self-pity, I guess, have compounded and but it's considerable.
Self-help books actually serve their purpose at some point, but you felt a disconnect with yourself. So there have been an added guilt when you are itching to smoke something. Is that it?
Yeah. Now I'm integrating both my medications and this therapy session. But I think need to integrate activities more like going to the gym or other hobbies outside my work.
Okay, that's good. Do you still have options that you consider?
I think that's all. Just to occupy my thoughts with healthy mechanisms when my anxiety spikes.
Thinking all those behaviors, which are most likely you think will reduce your hunger for smoking drugs?
I think the therapy sessions that I am referred to, and as well as finding a hobby.
So what type have you been eyeing?
I want something that I want something that will move my body. And I've been eyeing this equestrian classes inside Forbes. So yeah.
So these behaviors like going to therapy and being physically active would lead to your symptoms being reduced.
Yeah, right.
Okay, so the integration between your choices is something that you're confident that you can easily follow through. So are those behaviors elicit a confidence in you that it would result to a higher probability of success?
Yeah, I mean, I'm willing to get out of my situation, and those are the options that I think will work. So I guess there's nowhere to try.
Okay, so Rika, let's not focus on the guilt when the substance hunger kicks in. What we are focusing on is something that can bring back that sense of winning, and that is by focusing on applying those behaviors that you have mentioned. And let's say that after a week, we'll try and reflect on those behaviors, whether if it's something that is sustainable. But let me remind you of our goal, and that is to gradually wean you from substance dependence. So we are doing a more doable response into it. So you tune into your hunger for smoking drugs, elicit a negative cognitive and emotional response. Too, so we're not gonna focus on what actions that will cause you your guilt. And this guilt opens a traumatic past that leads to distorted cognition of yourself, and this elicits heightened anxiety and guilt. And that it is also relieves that similar physical manifestation you have felt back then, and you mistake it as the same feeling of the physical symptoms of the pressure or anxiety that is rooted in the present. And like you said, your work, and so now we're trying to change your behavioral response to the physical symptoms of anxiety-inducing situations in order for us to navigate what is going to work and what is not. So thank you for being here with me, and let me help you put your dilemma into the surface. It takes so much willpower and motivation to lay out your problems in counseling. And I applaud you for being conscious with your choices. Anyways, if you encountered problems along the way or you want to clarify some questions, just call me so we can set an appointment right away to address your concerns.